And it always goes live before I think it does, so. Okay, it says we're live. Hey, everybody. Happy Friday. It's Lisa Blaisdell with my old friend, not that we're old, but our friendship is old. My old friend, Dr. Elizabeth Lyster, Liz Lyster, who is in the Bay Area now. She left Orange County in Southern California and is a real expert on women's health. And because you are a woman who's probably watching this, although men love Facebook, but I find that most of my friends are women, and so many people that are in my network care about their health and care about ways that they can be healthier, especially at our age. I just was so excited that you had some time in your very busy schedule to share with people that will tune into this, both live now and later on. I just want to make sure we are live, which I'm sure we are. But I'm so excited, Liz, to have you on and to just talk about things that matter to women today, which is our health and specifically our hormone health. So I just want to read to you who Dr. Liz Lyster is, in case you do not know her yet, but she is an OBGYN, and a medical doctor. She's also a best-selling author. She's a speaker, and she is an expert in perimenopause and menopause. So ladies, hang out. She has a private practice in San Francisco, and she helps women and men which I think is really important, in midlife and beyond, to lose weight, have more energy, increase their motivation and drive, and generally feel great. Who doesn't want that? Liz graduated from Cornell University, went to medical school at UC Irvine down here where I am, got her master's degree at UCLA in communication and health education. Very credentialed. And Dr. Liz walks her own talk. When she turned 50 a few years ago, she celebrated by climbing to the top of Mount Kilimanjaro in Africa. I want to hear about that. And she also has 2 young adult sons that are my girls' age, and that is how we connected. She enjoys hiking and Argentine tango with her husband. And I want to hear about that too. So Dr. Liz, my friend, thank you so much. I'm so excited that you're here. So tell me, like a lot of physicians in your capacity, I have an OBGYN down here. A lot of women have their own OBGYNs. They're still having babies, seeing patients, but you took a different twist with your expertise and in your practice. Yeah. So why? What led you to wanting to really share your expertise around this topic of hormones and health and women in the age that we're in?
Yeah, exactly. First of all, so lovely to reconnect with you. It's so great.
I know, it is so great. I love it.
Yes.
I love it. That's what's good about social media, by the way. I know it can be, there's a lot of negatives, but there's a lot of positives too. I like to focus on that.
Exactly. Yeah. So the first piece was when I was in medical school and rotating around the different specialties. What really got me the most about OBGYN was following one of the senior residents, who's actually a doctor, still one of the main top doctors in Orange County. I was following her into a room with a patient, and all she did was talk to this patient. This patient had menopause symptoms. I'll never forget it, because just finishing talking to the patient felt better. And I really liked that. So fast forward, so I go into OBGYN, and I'm still board certified in OBGYN, but I stopped doing OB when my kids were pretty small because I prefer to sleep at night.
Yeah.
So that was pretty simple.
Yeah.
Reason for stopping the delivering babies, way ahead of when most doctors do that.
Yeah.
And focusing on the GYN. And then my practice just kept narrowing and being more focused. And I got to my early 40s, and I was 43 when I went into menopause, which was a bit of a surprise.
Yeah, that's early.
Yeah, that's definitely early. And at this point, I have women asking me and talking to me about it. And again, I'm going to conferences, additional conferences, and learning about it, and just loving what I was learning and realizing that the conventional medical world was not realizing a lot of information about hormone replenishment, and that women were not being properly served. And then I just kept narrowing my practice.
That's
That was the evolution of it.
That's awesome. So who is a typical patient that you see today?
You and I are a typical patient that I see today.
Yeah.
So most of my patients, as you said, I take care of women of all ages and also men. The men I take care of are in their 30s, 40s, 50s for the most part. And by the way, that started when women said, please, you got to help my husband. He's having the same symptoms, feeling more tired, feeling brain fog, gaining weight, even though he's doing everything the same. And the doctor says, you're just getting older.
Right.
Okay, so, but my most common patients are women of our age, 40s, 50s.
Yeah.
I'm seeing hormonal imbalance younger and younger. I do have women in their 30s and 20s. And then I take care of some of my patients' teen daughters as well, because our world is just very hormonally disruptive at this point.
Yeah.
And then up to 60s, 70s, I call it 60s and better. So all ages really, but primarily in our group.
Right. Okay. Okay. And so what are some of the, what are some of the most common things that you see? I don't think this is going to be a surprise to anybody, but I just think it's worth, talking about, because there's still, I think, I don't know, for me, I feel like there's still a lot of, not shame, maybe shame, but just like confusion and, well, why am I feeling this way? And people don't even really recognize what's happening. Like what are some of the typical things that you're seeing?
Okay, that's exactly right. I don't think it's shame anymore. I think that's another thing social media has done, is allows women to talk about these topics that for generations weren't talked about. The most common symptoms are fatigue, foggy brain, gaining weight, even though you know that you're eating and exercising the same, lack of libido, sleep disruption. All of these symptoms happen before the classic hot flashes and night sweats that are, in the Menopause, the musical.
Right. Yeah. Right.
Which I finally got to see recently.
I have not seen it. I would love to see that.
It's cute. It's funny.
Yeah, that's great. So, okay. So women are experiencing this, and I'm sure the age, like it can start in 40s, it can start in 50s. I was told that the longer you hang on to the perimenopause phase, that the better off, like all those symptoms won't happen as quickly. Is that true? Or do those symptoms happen in perimenopause in addition to menopause? Or maybe like back up. I asked more of an advanced question. What's the difference between perimenopause and menopause?
Okay, great. That's a good question. Okay. Menopause is once a woman goes either one whole year without her period, or if she has surgical menopause, and then it's of course sudden onset with removing the ovaries. Okay. So a whole year without a period, that's combined usually with blood work. Okay. That shows that a woman is in menopause. Okay. And then perimenopause can be 10 or more years before that happens.
Wow.
Yeah. Wow, exactly.
So what's happening during that phase? Because that's a long time.
A lot, exactly. So first of all, the first hormone to decline is progesterone, which can typically decline as early as our 30s, for some women even earlier. And that contributes to anxiety, sleep disruption, mood issues. And then in our 40s, again, this is the typical, lots of exceptions to this, is when estrogen starts to either go up or go down. Women can be estrogen dominant, they cannot have enough estrogen. And that also contributes to mood issues, makes the sleep worse, makes the weight go up. Yeah. All those types of symptoms, hair changes, skin changes, right? Things that we are concerned about at this point.
So you must encourage your patients then to get really good blood work, and I'm sure you do more than the traditional practitioner would. I'm just assuming, because there's some things that you don't always see.
Yes, exactly. I do way more testing. Not only do I check all the female hormones, I also check testosterone, which a lot of people don't realize women have. Also thyroid, adrenals, vitamin levels,
Yeah.
There's a lot to look at. And it takes time to go over all this. And most
Right.
doctors nowadays are strapped for time.
Right. Right. So that really led you onto a journey of wanting to get the message out in a broader way because you've written books. I know you're speaking a lot in the Bay Area. Do you ever travel to speak
Yeah,
further?
absolutely.
You do? Oh, that's good.
Yeah.
That's good.
Yeah.
And so why did you want to do that? Like what led you to wanting to get out of the practice, seeing patients? I mean, you do both.
I,
So
I do both. I love my practice. I don't deal with insurance. That's one thing that's really key to my happiness. Just going to be honest about that. I wrote a whole blog just about why I don't take insurance.
So a lot of health, if there's a healthcare professional watching this, then they can read that and probably be like, okay, we got to change some things. I mean, my naturopath that I see here for hormones does not take insurance. I mean, and that's a whole nother conversation around, how hard that is, because I don't think that should be the case. Cause I think every woman deserves the level of care that you provide and the level of care that so many women seek out, but they mostly can't get it from a traditional insurance based.
Yeah. Yes. Well, this is connected to the question that you asked about what motivated me to really want to do more reaching out and getting information out into the world. The first thing that motivated me to write my first book 11 years ago is that I was saying the same thing over and over again, one by one, to women. And I was actually taking insurance at that time, but I couldn't keep my doors open because I was spending too much time with my patients. I just couldn't get enough women into my daily schedule to keep the office open. So fast forward to now where, I want the books to get out there. I want, women read, like you said, women purchase 80% of books, and we drive healthcare as well.
Yeah.
Okay. And so everything that I'm doing is to get the information out on a bigger scale.
Yeah,
and
absolutely.
hopefully to influence healthcare, to influence other doctors. I posted something recently. It was last week related to the virus and cold and flu season, and it's a natural supplement that boosts the immune system. And I had a doctor reply on Twitter, and I actually didn't really understand it, but it had a lot of sort of like angry face emojis. I'm thinking, okay, I'm assuming this is a regular doctor who's not happy that I'm promoting a natural supplement.
Right.
So I was able to send her back a link to the research on the supplement.
Right.
Another advantage of social media is quick turnaround and hopefully be able to get the word out to doctors.
Right.
I'm more about taking care of women for now.
I understand that process for sure. So what's your, I'm sure you get asked a lot of questions. This is something that I hear things about, but I don't know a lot about it really yet because I'm not there, and you don't tend to learn about things until you need to,
Right.
So what's your position on hormone replacement therapy? Like how do you approach that? And I mean, there's some negative things to that because it was, linked to causing breast cancer and some other things a while ago, but I'm not sure if that data is relevant anymore. Like what's your knowledge on hormone replacement?
Yeah, absolutely. This is my one single favorite topic that I could talk about all day long. So I will tell you the briefest of bullet points. The Women's Health Initiative in 2003 is what got everybody scared about the connection between what I call hormone replenishment, and breast cancer. We now know without any question that the reason that there was an increased trend towards breast cancer in that study was that it was a synthetic progestin. It was a non-bioidentical progestin that was used in that study. That's it. End of story. That progestin is linked with increased risk of breast cancer.
Okay.
Bioidentical progesterone is not.
Okay.
We have huge studies in the United States and in Europe that confirm this.
Okay.
So that's important piece number one. And the other important piece is what we now know. Well, there's actually, like I said, I could keep going, but I'll contain my enthusiasm. The estrogen that was used in that study was an oral estrogen.
Okay.
When we swallow estrogen, it goes down in the stomach, stimulates the liver to make clotting factors, and increases clotting risks. lots of incredible data ever since 2003 that confirms what I'm saying, that when you apply estrogen on the top, topical on your skin,
Yeah.
or hormone pellet therapy where it goes under the skin, as long as it's not by mouth, you don't have those increased cardiovascular risks
Interesting.
and lower risk of breast cancer.
Wow.
I
Wow.
know this is a really tough one.
Powerful just in how it's absorbed into your body. That's so fascinating to me.
Yes. But
Wow.
even the women taking the oral estrogen in that study. So in 2003, that hit the news, and bad news travels fast, as we know.
Yes.
The women, so that arm of the study was stopped. And the other arm was women who'd had hysterectomies. They were only on the oral estrogen or placebo. And
Okay.
they had those cardiovascular issues because they were taking oral estrogen. But the women taking estrogen, Lisa, had less breast cancer.
Isn't that powerful? That's
There
powerful.
you go. So, for women who need it, it is safe in the right forms.
Right. Right. No, that's good. That's so important. There's so much misconception around these topics, for sure. So, okay. So explain to me the difference though, because I'm all about being proactive and prevention and staying well.
Yes.
Like why do some women, and this is sort of a rhetorical answer that I'm just like gonna set people up right now, why do some women like me, okay, I'm 52, I'm very perimenopausal, I'm very much not in menopause, like at all. I feel good, I sleep great, I like am not like, I mean, I would love to lose 5 pounds, but it's not like there's no like overweightness here going on really. Like we all would love to be a little thinner. I don't know, maybe I'm just bizarre, but like I'm not overweight. I'm like really strong. I exercise 6 days a week. Like I'm not foggy. I do take progesterone, but that's it, in addition to all the other good things I do, but I do a lot of good things. So why is someone like me doing okay? And like, there's like someone that looks just like me, like not doing okay. I mean, is there a good, I don't even know if there's an answer to that, but I don't think it's a coincidence. I am super proactive, and I know, but a lot of other people are as well. So like,
Yes.
like there's probably not a good answer to that, but it's just I know a lot of people are like, why am I having all these challenges and I'm doing everything right? They feel like they're doing everything right.
Yes. Absolutely. Well, first of all, I know how long and how hard you work on your life, and that you've worked on your life and achieving balance and excellent nutrition. We know that makes a difference. Let me back up and say that genetics are only about a third of the picture.
Hmm.
We say that genetics can be the I don't like this analogy, but like I've heard that said genetics is loading the gun, but all the choices we make pull the trigger.
Yeah,
Okay, if someone can think of a better analogy, they need
I
to
know, I agree, but
put it in the
I
comments for
understand
us.
for sure.
Okay. Okay, but you know what I mean.
Totally.
So I just want to set that aside, okay? Because but I really think that there's a lot more endocrine disruptors in our world, and
Mm,
there are choices that we can make, eating as organic as possible, uh, managing stress as well as we can, all things that I know that you've worked hard to do in your life, and
yeah,
I am working on an ongoing basis in my life.
totally.
Again, for me, the idea of replenishing hormones is a wonderful shortcut. It
Mm,
helps women navigate. For example, if women are having those issues, even the American College of OBGYN at this point, they used to say use as little bit of hormones as possible for as short of a time. They're even repicturing and reframing that with all the data that we have.
interesting.
Mhm.
Yeah, yeah.
So some
So
women struggle because they're just exposed to a lot more stress. They're not sleeping well. A lot of women our age have kids and adolescents under the same roof,
yes,
going through all of this. So
kids,
that's
kids and adult kids,
yeah,
and parents, aging parents.
that's absolutely right.
Yeah,
Yes.
yeah,
Yeah. Funny,
yeah.
people don't talk about the sandwich that much anymore. I think it's just become the new normal.
It is the
So
new
we
normal.
don't even talk about that. I remember when that was a new thing that everyone was talking about.
Yeah, because our kids are hanging out a little bit longer just because of the way that the world is, where you and I probably left our nest, end of high school, whatever, that was it, kind of never went back. That was my story, but that's not the case for this generation of kids. We've talked about that.
Yep, exactly. We've shared.
Yeah. So, but stress, you talked about stress and, we talk a lot about stress, like everybody talks about stress, but it's real. I mean, it is real.
Right. That's right.
So it's really screwing with those cortisols. I was listening to some of your speaking on your website, which I want you to share with everyone. It really does disrupt the whole hormone system.
Correct.
Correct?
Exactly right. And most regular doctors don't even know what to do with that.
Right.
I always say you got conventional medical doctors over here, and then down at this end, you've got the anti-aging doctors that take care of the movie stars and do all the experimental stuff that gets crazy news coverage.
Yeah.
And I'm on this side of the middle because this is the side that we're on, where it's proactive, it's wellness oriented, it's not just disease detection and treatment over here. Okay,
Right.
more on the preventive side.
Right.
That's exactly right. And on this side, in medical school, I was taught about adrenal tumors or adrenal failure, and there's this whole area in between where the adrenals. The term has been adrenal fatigue. We are replacing that now with hypothalamic pituitary adrenal axis dysfunction. So the science is really clear. This is not made up. This is actual. It can be tested. It can be addressed.
Yeah.
Exactly.
Yeah. Yeah. I took a test just because it's so talked about. And I figured, well, I should probably find out. And it was the saliva thing. And sure. I don't have adrenal fatigue, but I'm also not fatigued, really. I am really not fatigued unless I have a couple of bad nights. My husband snores, something like that, which happens. Sure. But I feel really thankful that I'm not walking around like a zombie. I know a lot of women our age are, and that there's nothing worse. There's just
yes, and the doctors give them Band-Aid drugs. That's another passion of mine, is for women and men, of course, as well. But women in particular, don't just take a Band-Aid drug. It's okay. You got to put a Band-Aid when there's bleeding, but you still have to fix what's happening underneath.
Right.
Okay, so a Band-Aid drug is an antidepressant, a sleeping pill, sometimes an oral contraceptive pill.
Yeah.
Can I take a minute and tell you about the anti-aging conference I went to in December?
Yes, please do. Yeah, because I was going to have you share tips, but this is like people want relevant new information that's going to help them.
Yeah, this is an organization called A4M, American Academy of Anti-Aging Medicine.
Wow.
An annual World Congress in Las Vegas in December, and I went for the first time. It was absolutely phenomenal. And so they were talking about everything that you and I are talking about. But adrenals, just everything. Okay, all of the different testing modalities that are out there, which little by little are they're going to make their way. Genetic testing, genomic testing.
Wow.
All of these different features.
Wow.
Aspects of medicine that eventually are going to be part of it. Okay.
Right.
Yeah. Right. So, and I got to hear a really wonderful presentation on the birth control pill. It was very interesting. The birth control pill was not created to treat symptoms.
Right.
It was created to allow women, specifically married women at the time, was only given to married women in order to help them space out their children. That's it. Right. They just found that it had other benefits, like regulating the cycle, and some women had skin issues, acne that was being cleared up. And so now we know why it does that, but that's not the purpose of the pill. Yeah. So the pill can help. Right. But there's still underlying, for example, menstrual issues that women have, say in their 40s, even their 30s. Yeah. Almost always has a thyroid component. For example. Yeah, it's super interesering.
So if you're using that as a Band-Aid, it may not allow you to find the underlying cause of whatever the symptoms are that the pill is treating.
Exactly.
Okay. Yeah, that's important. That's important to know. Yeah, there's a lot of young women in this country that are using that as a tool for lots of different things other than, in addition to, birth control could be one of them, but
Yep.
skin is a big thing, especially with teenage girls.
Yes, which of course is an endocrine issue.
Yes,
Okay.
totally.
All
Yeah,
the things in our food, what they feed the animals that we eat,
yes,
for those of us who have the omnivore diet,
yes.
it's really, it's crazy times. Our bodies are trying to detox all the time, but we have to support the body.
Yeah, absolutely. No, I love that you focus on that, Dr. Liz, because it's so important that we really don't look at this as just like, okay, that's what all the little, like hippie wellness people do. Like, this is like, it really has, our bodies have just been so overwhelmed with toxins for so long, and it isn't getting any better, that it is disrupting, these certain areas of our health. So, no, it's so good. So, how can people find you? Like, a lot of my friends live not in Southern, you're not in Southern California anymore. How can they continue to learn from you? How could they even, try to work with you if that's something that they want to do? How do they find you?
Easy. On my website,
Okay.
it's drlizmd.com, drlizmd.com.
And I'll put that down in the comments so people
And the
can.
first step, yes, and I do work with people virtually, so that's definitely
do.
part of the picture. So it
Okay,
doesn't matter where people are. If they want to work with me, we can make that happen.
Okay, good. Good.
And I made sure it was working before we had our call together today, that on my website, you can sign up for my online community, which
Yeah.
I'm working really hard right now on growing, because that's how I'm going to announce other initiatives that I'm doing.
Yes.
That's where I write a blog about once a month. I don't drown people in emails. For example, last week I did a special one on the coronavirus and talked about that. This week I did another special kind of impromptu email about International Women's Day.
Oh, yeah. Love that. Love
Okay,
that.
so I have fun with it,
Yes.
and so I love to welcome people, and I want to make it really worth your time to join the online community. So I did
Totally.
something that I wasn't really originally meaning to give this away for free, so I don't know how much longer I will. But right now, when people sign up for the newsletter, they get a video series that I created based on my first book. So my first book is Dr. Liz's Easy Guide to Menopause. So
Yeah.
this is a 7-part video series. It adds up to about an hour of videos over the 7 videos, and one will come each day.
Wow.
Yes, it was really an effort. It was professionally recorded. It's really, really a wonderful video
Okay, I
series.
signed up the other day, but I haven't seen anything yet. So I
All
want to
right,
go
I'll make
re-sign
sure.
up.
I'll
Okay.
make sure. Exactly.
Okay.
And of course, I want people to know about, and you're so awesome about helping me get the word out. This book, Go for Great, Dr. Liz's Guide to Thrive at Every Age, is pretty much where you started us out at, which is saying that we want to stay feeling great.
Yes.
We
Yeah.
want our kids to grow up healthy and sane and launch out into the world. And then we still want to have our wits about us and feel
Totally.
good in our bodies and go
Yeah.
out and thrive.
These should be great years. I mean, they
Yeah.
really, I feel so passionately about that. And I'm so grateful for your time, Dr. Liz, because I know how busy you are, but I wanted to share you with people because people, that's why I do what I do. I want people to feel well, and let's age well. Let's not just like assume, okay, well, I'm 60 now. This is the way it should be. No, like I do believe in thriving. I do believe that, no, I'm not 22 anymore, like my daughter. And, that's cool. Like, I don't, look like that anymore. Gravity does have a way of like catching up, but, it's not about that. It's about thriving in our 50s and thriving in our 60s. So I so appreciate the work that you're doing, and the fact that you were brave enough to really expand the way that you work and the way that you help patients and the way that you really want to help men and women, because I do think that it's not easy to do what you're doing. And I'm sure that you have challenges, being a medical doctor, and yet you're still persevering. So I so appreciate you and your time. And I want to get you to Orange County. So we're going to
Sure.
talk about that.
Awesome.
Yes.
That'll be
Yeah.
wonderful.
Yes, I will post the links below so that you can find Dr. Liz friends and that you can find her books, sign up for her email because that sounds like an amazing video series. So thank you so, so much. Just love and appreciate you and have a great, great weekend. Everybody stay healthy. And thank you so much, Liz. Just this was so fun. All right. Have a great day.